Greetings and congratulations on your recent purchase of the Biotechnique AVANCE SDL laser diode system. In this 10-minute informative and concise video, we will address clinical data, equipment setup and testing, safety procedures, pre-treatment preparation, after-treatment care, equipment maintenance, and general questions and answers. Be sure to read your instruction material thoroughly, as this video does not cover all aspects of the treatment procedure. It is intended as a tutorial overview and introduction, which only highlights the basics you will need to know. Chapter 1, Introduction. Dr. Melanie Grossman reviewed clinical data using an 808 diode laser on 100 patients with skin types 1 through 6. Dr. Grossman is an industry expert with extensive credentials in the field of phototherapy. In the clinical study, each subject had 7 test areas, 5 of which received a single laser treatment and 2 that received an additional treatment after 90 days. Follow-up data at 3 months showed a statistically significant growth delay in 100% of the subjects. Hair growth counts at 90 days showed an average of 80% reduction among the 100 subjects. Additional clinical studies and published material may be found by referring to your instruction book. Chapter 2, Equipment Orientation. It is important to fully understand the control locations and the features of your SDL equipment before use. Key lock safety switch, pulse counter reset, system status, intensity selector, pulse frequency, laser status, laser jack, protective eyewear, diode temperature readout. To prepare for use, plug the laser into the driver unit. Insert safety key and turn right. Place your pulse setting on level 3. Place your intensity selector also on level 3. Reset pulse counter. Your laser is now live, and extreme care must be exercised while handling this instrument. Eye protection for both the operator and the client is mandatory. Remove safety key when not in use. Always allow adequate cooling for your laser diode. And always patch test before full treatment. Chapter 3, Treatment Procedure. Before administering treatment, determine your client's skin type by referring to the Fitzpatric Scale in your instruction material. Clients with very light hair growth, blonde, gray, and red, will require additional pigment in the form of carbon dye before treatment. Be sure to thoroughly clean the skin with ethyl alcohol after carbon dye application. Scan the treatment area at a rate of 1 inch per second at 120 joules per centimeter squared. Stubborn areas will require a slower scanning rate for optimal results. Your laser will make a clicking sound during application, which is normal. Hold the laser instrument 1/2 to 1 inch from the client's skin and never allow the laser optics to come in contact with the client. Chapter 4, Post-Treatment. It is normal for the skin in the treatment area to experience some degree of vasodilation. This is considered a sign of success, as the skin is reacting to the trauma inside the follicle pore. The use of a topical lidocaine or aloe gel is recommended. Regrowth after treatment is normal. Most of this activity will be coming from follicles which were dormant at the time of the original application. Follicles can only be destroyed in the early anagen phase, which occurs once every 90 days. Most clients respond very well to a series of treatments over 4 to 6 weeks. 8 to 10 treatments over the period of 90 days produces the most lasting results. Laser hair removal, Chapter 5, Equipment Maintenance. If you're going to be using this unit overseas, you will have to convert the voltage. Remove the 2 screws from the underside of your driver unit. Remove the top cover as shown. Switch to the appropriate voltage, 115 or 230. Make sure your cooling fan is operating without any obstructions. Smoke and vapor from carbonized debris will eventually occlude your lens. It is essential that you keep this lens clean, otherwise serious damage may occur. This will keep your laser operating at optimal performance. Your temperature gauge will turn black up to the correct number. Do not allow your diode to exceed 160 degrees. Chapter 6, Questions and Answers. Laser epilation can be uncomfortable on sensitive areas. Pre-treating with a topical anesthetic or an ice pack will reduce this sensation. The site-specific trauma achieved by laser epilation permanently deactivates the follicle tissue. Laser epilation is a non-invasive procedure which is generally exempt from local health codes which regulate electrolysis. Follicles require a minimum of 32 joules per centimeter squared for effective treatment. Should your system ever need service, just visit our website and click on Technical Support for assistance. Lasers can be used for pigmentation problems, resurfacing, rosacea and sun damage, scar reduction, and tattoo removal on most inks. The instructions sent with your equipment are intended as an entry-level information source. For additional information, please refer to the textbook Lasers and Lights by David Goldberg.